Firstly, can you just introduce yourself, please, Neil?
Yeah, my name's Neil Flowers. I am the Head of Clinical Education and Research for the East Anglian Air Ambulance.
And what is it like working as a paramedic in an air ambulance?
It's a great job. I don't think there's anything quite like working on an air ambulance. Nothing really can prepare you for the kinds of things that you will see, for the experiences that you'll have, from some of the psychological effects that you suffer, and some of the things that you're exposed to. It's a very, very unique job, and I probably made that sound quite negative. It's not negative. That's a positive in the sense that when you work on an air ambulance, you are passionate about pre-hospital care and you want to make a difference for people's lives. So it's an amazing job, and I'm very lucky and privileged to do that job.
What is the most rewarding part of the job?
I think working with like-minded, passionate colleagues. So it's a slightly unique team, and the composition of the team is made up of different professions. So there's pilots, doctors and paramedics, and we all come together to form a team. So it's not about the pilot or the paramedic or the doctor. We are a team, and you succeed together and you fail together. So I think for me, the best part of the job is about being part of that team and contributing and the camaraderie. And obviously there's also a lot of fun when we attend patients. It's very serious and we're very professional. But outside of that, I think because of the job that we do, you have to have a bit of fun and you have to have a bit of, as we would call it, banter. So yeah, that's probably what the best part of the job is the camaraderie that you have with the crews.
And is there something about the job that people listening might not actually know?
I mean, there's lots of things about the job that people wouldn't know because it's a very unique job. What I would say is that it's unique for a number of reasons. You start your shift in the morning. It's normally 7 till 7 days and nights, and probably the first 2 hours of your shift, unless the phone goes and you are tasked to an incident, the first 2 hours are normally taken up with kit checks and drawing up drugs and fairly routine type stuff. So that's a little bit dull. For the rest of the day, the time is yourself. And there is an expectation that all of the clinicians will have a commitment to training and education and to make sure that they are up to date with all their mandatory training, that kind of stuff. But the time is your own. So if you've had a particularly unpleasant shift, the day before, it's not unreasonable to just spend the day not doing too much. If you want to sit around, chat to people, so I think that's quite unique in the role that most employers would see, in terms of productivity, would want people to be busy and to be active. For HEMS teams, being productive sometimes can mean making sure that they're looking after their health and well-being, which could be sat on the sofa watching a video. So yes, it's a very unique job. I think probably the thing that I would say that people wouldn't know is just the level of team spirit that exists within that team. Because of the things that you're exposed to, you rely heavily on the people around you. So yeah, in that sense, that's probably the thing that people wouldn't see so much behind the scenes.
Do you have some advice for someone who wants to become a paramedic?
Yes, if it's something you're passionate about, then go for it. Because what I would say is people probably have. I was the same before I joined the ambulance service. I had my own ideas of what that may look like and what the job may entail. I think that the easiest way to do it now is you can expose yourself to certain areas of healthcare in a voluntary capacity. And I think really you just need to be able to look to be able to help people and see what it's like to look after people when they're poorly or when they're injured. And there are certain voluntary organisations that can give you some exposure to that. So there are plenty out there. So what I would say is if it's something you want to do, then yes, absolutely, grab it with both hands and go and do it. But maybe get a little bit of a taste for it before you fully commit to it, because things have changed. I'm quite old, and when I joined, you didn't necessarily need to have a degree when I joined the ambulance service. Nowadays, students come into the ambulance service and they have to go to university to get a diploma or a degree. And that's obviously a big financial commitment. That's a big time commitment. So I would say give yourself some exposure to the role as best you can, just to get a feel for it, to make sure that it is something that you want to do.
And how important is fundraising to air ambulance charities across the UK?
Yeah, I mean, fundraising is absolutely, it's like the foundation of our organisation. Without fundraising, we don't have pilots, we don't have doctors, we don't have paramedics, and we don't have a helicopter. So the fundraising is the absolute bedrock of our organisation, and the fundraisers, and not just the fundraisers, but there are so many different departments within the East Anglian Air Ambulance, and they are all geared towards the same goal, which is to send our teams out to try to make a difference to people's lives, to reduce pain and suffering. And to do that, we need money. And, we receive no regular government funding. We rely almost entirely on the support of the public. And each mission costs approximately £3,750. That's just each mission. Aviation and medicine are both expensive. You put them together, they are incredibly expensive. So fundraising is incredibly important. And we are very lucky to have such an amazing team of fundraisers and also teams of people that support those fundraisers to allow them to do their job. Big shout out to the fundraisers.